Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
My next guest is Dr. Lila Massoumi. Dr. Massoumi is an integrative psychiatrist with a private practice with 3 physician assistants in the Metro Detroit area of Michigan. She is the chair of the American Psychiatric Association Caucus on Complementary and Integrative Psychiatry. She is Clinical Associate Professor of Psychiatry at Michigan State University. She's a contributing author to the textbook Complementary and Integrative Treatments in Psychiatric Practice. And she is the author of the first ever chapter on complementary and integrative treatments for the American Psychiatric Association Textbook of Psychiatry. In addition to her commitment to patients, Dr. Massoumi's mission is to change the way psychiatry is practiced in the United States. Well, good morning. Thanks for joining us.
Thanks for having me.
Tell us a little bit about yourself.
So I'm an integrative medicine psychiatrist with a private practice in the Metro Detroit area. I chair the American Psychiatric Association Caucus on Integrative Medicine and Psychiatry. I'm clinical associate professor at Michigan State University, and I've authored a few textbook chapters, including the first ever chapter on natural treatments for psychiatry for the textbook of psychiatry for the American Psychiatric Association.
That's very impressive. What is integrative medicine and psychiatry?
Okay. So as far as when people ask me what is an integrative medicine psychiatrist, I would say that the short answer is that a conventional psychiatrist, integrative medicine psychiatrist, combines conventional medical care, which in psychiatry tends to be medications and either doing psychotherapy or referring to a therapist, with non-medication or non-mainstream treatments. Those can include supplements such as herbals, electromagnetic treatments or the use of electricity and magnetism to affect biological change, and an emphasis on lifestyle factors like diet, exercise, meditation, and other mind-body practices.
So how is integrative medicine different than conventional medicine?
So the definition of conventional medicine, if you were to look this up on MEDLINE, which is the bibliographic database maintained by the National Library of Medicine, is those medical interventions taught extensively at U.S. medical schools or that meet the requirements of the generally accepted standard of care. So there tend to be a lot of evidence for conventional medicine treatment. A lot of the studies are done by drug companies that have a lot of money to do large studies. And I'd say a lot of the conventional medical interventions, i.e. medications, we know about as physicians because the pharmaceutical industry also has a lot of money for marketing, to come to our offices, to teach us about their product, to teach us about what studies were done on their product, as opposed to either generic medications or supplements where there's no big money to support coming to our office and buying us lunch and teaching us about it. I would say some other differences between conventional medicine and integrative medicine would be that, in order to understand an industry, you have to understand how it's funded. And physicians are reimbursed via volume. So the quicker we can see a patient, of course, still marking it on our super bill as a high complexity case, or that we've done quite a few procedures or quite a few review of systems. If we can get the patient in and out, we make a lot more money than if we spend a lot of time with patients. In integrative medicine, we forfeit that, that benefit, and we spend a lot more time with our patients. Now, many of us, not including myself, but many of us do not take insurance for that reason, because we want to have sufficient time to spend with a patient to get to know them very well and to go very deeply into what might be going on medically and psychologically. So that might be the reason when some of your listeners are looking for an integrative medicine doctor and many of them don't accept insurance. That would be why. It's because we want to give you quality care and we don't want you to just come in and out. Now, integrative medicine has more to it than simply integrating non-medication treatments with medication treatments or conventional care. There are various values and tenets that we subscribe to, which I'm going to go through a few of them. And of course, I've written some textbook chapters, so I might sound more didactic than conversational, and I apologize. So for example, when it comes to the definition of health, in conventional medicine, health is defined as absence of disease. In integrative medicine, health is defined as the attainment of optimal health. How do we help you be the most energetic and vibrant psychologically and physically that you possibly can be? When it comes to nutrition, conventional medicine is looking at the recommended dietary intake recommendations, the RDI. That is the bare minimum of the nutrient required to avoid deficiency. So for example, in conventional medicine, when they looked at your lab work, they would want your vitamin B12 level to be above 200 nanograms per milliliter, whatever the unit of conversion is. In contrast, in integrative medicine, we're interested in your nutritional status being high enough that it reflects what the studies show are most likely to allow you to prevent chronic illnesses. So we know that in Japan, so in America, a normal B12 level is above 200. That's just enough to avoid peripheral neuropathy and overt signs of dementia. In Japan, a normal vitamin B12 level is above 500. And in integrative medicine, a lot of us would like your vitamin B12 level closer to 1,000, because that's the level that's been shown to minimize your chances of developing Alzheimer's and other forms of dementia. So our view on nutrition tends to be a little bit more picky than in conventional medicine. As far as treatment approach, in conventional medicine, and by the way, a synonym for conventional medicine is allopathic medicine, and that term actually comes from the homeopaths. Allo means other. So the idea in conventional medicine is that you are treating disease with a other or opposing force. So you have a fever, we give you Tylenol to oppose that fever and bring the fever down. So the treatment approach in conventional medicine is fight off the disease using an opposing force. In integrative medicine, we have a very profound respect for the body's ability to heal itself, and we attempt to provide nutrients and care that supports the body's ability to heal itself. Similarly, another tenet where we differ is the view of the body. So in conventional medicine, the body is divided into disparate systems. So for example, you might have the gastroenterological system, the neurological system, the endocrinological system, or endocrine. In contrast, in integrative medicine, we believe that all the different body systems are intricately linked, which we know they are. In fact, studies are beginning to show that the distinction between a brain chemical, i.e. a neurotransmitter, an inflammatory cytokine, or the chemicals released by our white blood cells to fight off infection, and a hormone, or the chemicals released by our organs, is much grayer than previously thought. In other words, there's overlap between the functions of those three different kinds of chemicals. So what I normally explain to my patients is that where conventional medicine shines is when it comes to an acute illness or an acute trauma. So God forbid, knock on wood, you get into a car accident and you are hemorrhaging. That is a time that you do want to be on the surgeon's table and you do not want to be on the acupuncture table or the massage table. In contrast, with chronic illnesses tend to affect a bunch of different body systems, and they all tend to contribute to your chronic illness. For chronic illnesses, whether it's fibromyalgia, migraines, diabetes, or a mental illness, integrative medicine is, in my opinion, of course, superior, because we're considering how everything is contributing to the illness that you're coming in for.
Well, that's a lot. And I love the idea that we're looking at an optimal health rather than just keeping out of the disease state. So you've talked a bit about how integrative medicine differs from conventional medicine. how might integrative psychiatry look different than conventional psychiatry? What does that process look like if someone comes to see you?
So I'll sort of walk you through what it looks like when a patient comes to see me, using me as an example of an integrative medicine psychiatrist. So the standard of care in psychiatry is that a psychiatric evaluation is between 30 to 45 minutes. Of course, that's the way you could also make the most money, seeing patients for a shorter period of time. And then at the end of the psychiatric evaluation, you're prescribed medications and or you're referred to a counselor, or the psychiatrist feels they can do the counseling themselves. In my practice, I spend 90 minutes with the patient. I start the session asking the patient what brings them in to see me, what problems they want for me to address, what their preferences are, what drew them to me to begin with, so that I know if they're anti-medication or pro, or what they're actually looking for. But I go, and then what I do, and this may or may not be different than conventional medicine psychiatrists, is I proceed with what's called a psychiatric review of systems. And that's when I ask the patient questions about just about every psychiatric disorder I can think of, minus the zebras, the very rare zebras. So for example, a patient might come to me for depression, but I'm still going to assess them for ADD, ADHD. And we might find out by the end that the patient actually has significant symptoms of ADD, and they've been fighting the ADD their whole lives. They haven't been able to perform at the level that would be expected for their IQ. And in fact, it is this battle that they've unknowingly been waging that's resulted in the worthlessness and hopelessness that have caused their depression. So for me, it's important to understand all the comorbidities or all the other illnesses the patient might be suffering from, even if they don't know that they're suffering from it, in order to fully address everything that's affecting them. After the psychiatric review of systems, I then ask about, and I'm skipping some sections, past medical history or what medical problems the patient has. And I might focus on those things that I think I could help with. For example, female cycle irregularities or mood swings as they pertain to female cycles, thyroid, sleep apnea, chronic pain, autoimmune disorders, inflammation. We know that if you're in an inflamed state, that you're 3 to 5 times more likely to relapse psychiatrically, even if you're currently stable on your psychiatric medications. And if you're in an inflamed state, an anti-inflammatory could actually have psychiatric benefit. Not a huge benefit. It's not like taking aspirin is going to cure depression per se, but so I'll ask about medical problems that I think that I can help with. Another thing that I do that other psychiatrists may or may not do is I assess for trauma in quite a bit of detail. So yes, I ask about overt trauma, whether the patient has any history of having been abused sexually, physically, or verbally. But I also ask about more subtle forms of trauma. Again, there's a misconception that if you haven't been sexually or physically abused, that you haven't undergone trauma. And it actually is a lot more subtle than that. It has to do with how sensitive the patient was, whether whatever was going on exceeded their ability to cope and made them shut down instead of become more resilient. So the question I tend to ask to elicit trauma is, did you grow up feeling like your parents understood you, appreciated you, and supported you in what makes you unique? Or did you grow up feeling misunderstood and or alone at times? And if the answer is the second one, to any extent, I ask them to expand on that. And that's usually where the trauma lies. If the patient is sort of blowing me off because they know their parents were well-intentioned and loved them, and so of course there couldn't be any trauma, so of course they were supported and loved, and they're really not even, I feel like they're not even giving much thought to the question I asked, I'll go a little deeper and I'll say, okay, could you please give me 3 words or phrases that would accurately describe, and I'll start with mother and then move on to father, that would accurately describe your mother as you remember her growing up as a child or adolescent. Not as your mother is now or how you perceive her now. How you would have described her when you were little to your child friend in describing your mom. And then that's where I might elicit something like loving, caring, overly controlling, something like that. And again, that word over controlling, that's sort of where the meat is. That's where a trauma may have come from. If there is a history of trauma, what do? I believe that in the modern day age, with as little therapy as psychiatrists are taught, we're given maybe one semester or one class per semester, that it is presumptuous for a psychiatrist to believe that they can do therapy. I do believe, now, if you were trained prior to Prozac era, then yes, the majority of your training was based on therapy. But after the Prozac era, the majority of our training is biologically based. And to think that one semester or one class per semester is as much counseling training as someone that's gotten a PsyD or an LPC, where 8 hours a day for 2 to 4 years, they did nothing but learn counseling. I just don't think you can compare those two things. So if I do have a patient with a history of trauma, I tend to refer out, or I don't do counseling myself. I find it too difficult to be an expert on everything. I did start psychoanalytic training, and there was just no way I could be an expert in business and in medicine and in integrative medicine and in counseling. It's just impossible. So I tend to refer out, and I'll give them the referrals at the end of the session, either to a therapist that I know that specializes in trauma, or I might refer them, for example, to Psychology Today. That is a popular magazine, but they have a very good website with a tab that says find a therapist, and you can limit it by your insurance, by your diagnoses, by gender. You see a headshot and their personal statement, so you can see if you feel intuitively drawn to them. And then if a patient has no idea how to go about finding, is this therapist good or not, one of the ways I encourage them to find a therapist that specializes in trauma is, and again, this is my own bias, is to look for a therapist that feels comfortable treating what's called dissociative identity disorder, which is the modern day term for multiple personality disorder, which is not common, but dissociation, or the tendency to compartmentalize and tune out, is quite common in anyone with a history of trauma. And a lot of the research on trauma has been in the past few decades, but it tends to be relatively newer information. And unless the therapist has really kept up with the latest trauma research, I'm concerned that they won't have the skills necessary to treat trauma fully. So I tell my patients, okay, when you try to limit your search of therapists, try to look for someone that says they're comfortable with DID, dissociative identity disorder. And if they are, I promise you, they have a ton of skills in their tool belt. At the end of my assessment with the patient, which takes usually about an hour, I provide them some education. I teach them what their diagnoses are, what their symptoms are that qualify them for that diagnosis. I also tell them what diagnoses their symptoms suggest, but I'm not sure they fully have it, but they have traits of it. So these are things we want to keep in the back of our mind, so that if such and such medication doesn't work and we're trying to figure out what would be a good fit, we might want to consider these other rule out diagnoses. And on the topic of diagnosing, I also want to make a point that one of the arguments against the field of psychiatry, one of the things that psychiatry is maligned for, is the fact that we diagnose patients at all. How can you diagnose people? People are not diagnoses. And the reason we do that is I want to help. And in order to help, I need to choose the right medication or the right supplement. And in order to choose the right medication or right supplement, I need to know what I'm treating, because all of the research studies on my meds and supplements were based on a given diagnosis. So if you have bipolar disorder and I'm giving you an antidepressant for people who don't have mood swings, I can actually make you worse. So diagnosis is important insofar as it guides prescribing. And that is why for diagnosing, and again, I apologize if I'm offending any professional career, but for diagnosing, I do believe psychiatrists are superior many times to therapists, because we have to get the diagnosis right. Now, that's assuming the psychiatrist has spent enough time with the patient. If the psychiatrist only spent 20 minutes doing a psych eval and the therapist has known the patient for years, the therapist is going to know a lot more than the psychiatrist. A therapist doesn't, in my opinion, and again, I'm getting off track, a therapist doesn't necessarily have to get the diagnosis exactly correct, because if all the therapist does is help the patient with their childhood trauma, the therapist is helping the client significantly, and it doesn't matter what the diagnosis is. Helping the trauma is going to help the diagnosis. So that's sort of my little spiel on psychiatry diagnosing and who diagnoses and who's, I think, is better at therapy. Other things I might educate the patient on besides their diagnoses is, and again, this is my opinion, but I believe it very strongly. I believe that everyone on this planet has an amount of stress that they can take above which they will develop a mental illness. And what makes all of us on this planet different is how much stress we can tolerate. So some people, their cat getting sick is enough stress to develop, for example, a mood disorder or a psychiatric symptom. And some people, God forbid, would need to be a prisoner of war with parts of their limbs chopped off daily for a few decades before they developed a psychiatric symptom. But we all have a breaking point. Sometimes I'll have a patient say, well, Dr. Massoumi, I'm going through a divorce, so I'm not really depressed. It's just that I'm going through a divorce. And I say, well, what's happened is the divorce has created now an amount of stress that your body and mind can no longer take, and now you are exhibiting symptoms. Now you're not able to sleep. Now your appetite has changed. Now you're having a difficult time getting out of bed. So yes, it is still depression, even though we know what the stressor was. I then educate the patient, and this is assuming we have time, on the difference between conventional and integrative medicine, and explain to them, yes, I understand that your primary care physician has already done lab work on you and told you, quote unquote, that everything is fine. But I want you to understand that I might look at that same blood work, and even though the lab itself says that you are healthy, yes, you're healthy, you're not going to have a serious issue in the next 1 to 2 months, I might say that your blood work has not been optimized, meaning I want you in a position of health to be in the top 15% of the population psychologically and physically. The last thing I might teach my patient, and I did this a lot more at the beginning of my career than I do now, but I think it's a nice thing to teach on, is I explain to patients my analogy of being born a rock versus a computer. And this is where I'm trying to normalize the fact that they have a mental illness, not have them see their mental illness as a bad thing and see how it could potentially be a strength, or that it's a symptom of the fact that they have a strength. So what I say is some people are born like rocks. A rock is pretty hardy. A rock can be thrown into the lake, thrown into the snow overnight, taken inside the next day and still be intact. A rock did not have to have perfect parenting. The rock could have been kicked around a little bit, thrown around, and afterwards it is still intact. It can still do its job as a paperweight, as a doorstop, as decoration, as a weapon, but it is still intact and functional. And then some people are born like computers, and computers feel their emotions very deeply, and they think deeply about things, and they are affected by the emotions of the people around them. And a computer needs to be maintained between 40 and 90 degrees Fahrenheit. It needs to have parenting that it's a really good fit for that particular computer. You cannot throw the computer into the lake or into the snow overnight and take it out the next day and expect it to work. In fact, its wires will be crossed, it will be completely broken, and it won't be able to do anything. And the point of treatment, whether medication or therapy, usually therapy, you get the wires fixed. And when you fix those wires, the computer can send people to the moon and do more even than the rock. So the same thing that made you a computer and may have made you more vulnerable to this mental illness is the same thing that's potentially making you exceptional. And if you overcome this, you are going to be able to do more than maybe someone who hasn't been through what you've been through. So that's my rock and computer analogy. Finally, we go to treatment planning. I order lab work. In my practice, I stick with lab work that your insurance will cover. I have various reasons for that. Then we talk about medications or supplements. Now, I want to be clear on something. If supplements were as effective as medication every single time, it would be malpractice for us psychiatrists to be prescribing medications. But the reality is, generally speaking, the effect size or the degree of benefit or the degree of improvement that you get from a medication far exceeds the effect size that you get from a supplement. Now, there are some workarounds. You can combine different supplements that each help you 5 or 10%, and then you combine them all together, and then you get a 40% improvement. But whether we rely on a medication or supplement is going to depend on how bad your symptoms are. So let's say, for example, if I'm treating depression, if 10 is the happiest your mood could be, 1 is the most depressed. What number is your average mood these days? A normal mood that I'm shooting for is a 7 or an 8. If a patient says their mood is a 6, that is mild depression, we can talk about supplements. If it is a 5, which is moderate depression, 4, which is severe, or you're having thoughts of suicide, then I'd rather give you a medication that will literally make you feel better in 3 days than just be talking about vitamin D and vitamin B12 repletion and hoping you feel better in a couple months by 30%. Now, I do have patients that are opposed to medications. And in those situations, I explore it with them. If they were put on a previous antidepressant and it made them more depressed, and so they think psychiatry is a bunch of hogwash or psychiatric medications are hogwash, I explain to them why the antidepressant made them more depressed, that mood swings or mood disorder is actually on a mood swing spectrum. That's not either depression or bipolar. It is a spectrum, and everyone is on this spectrum. And if you got more depressed on an antidepressant, you're probably on the mood swing spectrum, and we have medications for people in the middle of the spectrum, et cetera, et cetera. So I demystify the psychiatric medication. They might have a trauma history where the very parents that they were supposed to rely on, they couldn't. So you can't rely on people. You can't rely on authority. So how can you trust a medication? You have to trust the doctor. Whereas a supplement, they can do their own research. They can go to the drugstore or the health food store. They can buy it themselves and they are in control. Well, I want them to be aware of what's influencing their decisions when we're talking about something so serious as how we're going to treat their psychiatric illness. Now, if despite those things, the patient still absolutely does not want psychiatric medication, yes, I will start with supplements. And I do have supplements for probably just about everything. Usually there is a little bit of improvement from that. And if anything, the patient usually develops trust from that. Oh, you know, I do actually feel better. What else you got? What else can make me feel better? And then eventually they trust me enough that they're willing to, if I say, you know, just try this one time, just take it once before you see me and tell me what happens. And we can sort of break them in. I've already mentioned that besides recommending medications and supplements, I'm probably going to refer them to a therapist. If needed, I might refer them to an integrative medicine physician. To be honest with you, those of us in integrative medicine speak a different language than doctors in conventional medicine. So it's actually easier for me to work with other doctors that are also integrative medicine because we're sort of aligned. So I may make a primary care physician referral. Then I ask the patient what questions, concerns, or comments they have for me. I provide them a typed handout of my recommendations so that everything's very clear, and I tell them just follow the handout. On this handout, if I do recommend supplements, will be the brand of supplement I recommend, where to buy it, what the price is, what the instructions are. I do not sell supplements at my practice. I personally believe that that is a conflict of interest. I may, at the end, recommend some electromagnetic treatments, and that's a whole nother topic. Your listeners might be more familiar with ECT, electroconvulsive therapy, aka shock therapy, that is very extreme, helpful, but extreme form of electromagnetic therapy. That's not what I'm talking about when I say that. There are various other treatments. There's something called cranial electrotherapy stimulation, CES, which has been shown very helpful for PTSD, anxiety, insomnia. There's something called neurobiofeedback, or neural feedback for short, which can be very helpful for ADD in cases of traumatic brain injury. There's light box therapy, or using a bright light, for treating not only seasonal affective depression, but also depression of any kind. It has a 70% success rate. It's just very hard to comply with, to sit in front of a light box for 1 hour every morning. That can be difficult. And in general, the United States is behind Europe when it comes to electromagnetic treatments, and that has to do with the influence of the pharmaceutical industry on our FDA and difficulty in actually getting an FDA stamp of approval in the form of an FDA indication for electromagnetic treatments. The caveat that I would make as an aside, because I know this interview is for the purpose of your listener knowing, trying to figure out which provider they want to see themselves or refer their loved one to, is that in my practice, I do subscribe to a physician extender model. And what that means is, and some background, I get about 5 to 10 new patient inquiries per day. So 5 to 10, and each psychiatric evaluation takes 90 minutes. So there is no way on the planet that I could possibly see the number of people that are calling my practice. So what I do is I train physician assistants or nurse practitioners, and mostly physician assistants. So these are master's level healthcare providers that have gone through a sort of expedited or brief medical school, 4 years or 8 years is combined into 2 years. collapsed into 2 years. And then I spend several months training them ad nauseum with an hour lecture daily, with 2 months of shadowing me, followed by weekly supervision once they're off on their own, seeing their own patients. So patients that see me see my physician assistants, whom I have trained to be extenders of myself. And then if the PA or the patient feel they're not getting better quick enough, let's say within 6 to 8 months, the patient is then elevated or escalated to see me so that I can stabilize them. So that would be what it's like with seeing an integrative medicine psychiatrist, being myself at my practice.
Well, that's delightful. That's a wonderful review. I know people are going to want to tap into the transcript of this and look at it. Is it all right with you if I attach this outline or some form of it, if you'd rather do another to the...
Sure, I can give you another form of it. Some of it has my personal notes that might be not appropriate for viewing, but yes.
There's just so much good stuff there that I'd like to have them have access to that.
Absolutely.
It makes me wonder, how did you get into this?
Well, there's how I got into psychiatry and how I got into integrative medicine. So how I got into psychiatry, I was in Spain my junior year of high school, the summer after my junior year. I was homesick. I was reading the book, The Road Less Traveled, which is a best-selling book from the past, and people might not have heard of it, written by psychiatrist M. Scott Peck, MD. And what this book emphasized was that love is putting someone else's spiritual growth ahead of your own happiness. And I even get chills thinking about that phrase, that sentence. So that really resonated with me. And I'd always felt very different from other people. I was really self-analytical and analytical of I was a very analytical person. I was a very high self-monitor. I was always analyzing myself. I was always analyzing other people. I came from a long line of doctors on both sides of my family, and I already knew I loved science and helping people, so I already knew I wanted to be a physician. So suddenly the fact that I felt so different and kind of overly self-aware at my young age, uncomfortably, acutely self-aware, combined with my love of medicine, and then I was also very spiritual and had been for a long time, that book sort of conglomerated all of my interest into one thing. And so I decided at age 17 that I wanted to be a psychiatrist. As far as integrative medicine, that was a little bit more arduous of a path, or it came about more through, I guess what you'd call it, a healer's crisis. So I was in medical school, and I was faced with hypocrisy that I wasn't expecting. I came from a family that had always emphasized good health, good health, good health, and medical school, like I mentioned earlier, describing the difference between conventional medicine and integrative medicine. I kept being trained how to treat disease, but there was no mention of optimization of health. But then the hypocrisy I'd see is, for example, I'd be shadowing a primary care physician who himself was morbidly obese, and he would be criticizing his overweight patient for failing to lose weight. That seemed really hypocritical. And my biochemistry teacher was also obese, and he's the one that taught us nutrition. And we had to take a hiatus from our biochem class because he had a heart attack in his 50s. And then there was a morbidly obese patient in the hospital, and we were rounding, and rounding means a bunch of medical students and attending physician go room to room, seeing different doctors, and you go in the hallway and you basically talk about the case as an educational experience. And people were talking negatively about the obese patient, sort of blaming him for his condition. And having been myself bullied for 2.5 years of my youth, I really am turned off by groups of people getting together to criticize someone in a weakened state. So all those things together, I was really put off, and I wasn't sure I wanted to continue medical school. So I took time off and did a lot of reading, and actually ended up writing a book proposal and sending it in to an agent. And during that time, discovered what used to be called the American Holistic Medical Association, AHMA. And suddenly I found out there was this professional group of doctors that all felt exactly the same way that I did, who all viewed health as attaining optimal health, not simply absence of disease, and who thought love was part of the equation and felt that the relationship between the doctor and the patient should be one of partnership and mentorship and not a paternalistic authoritarian view that I say and you do what I say. And then I got a letter back from the agent that I submitted my book proposal to, saying that very few people are going to trust a book authored by a 20-something-year-old with no credentials, but that if I was able to get my medical degree, that my book would sell far more. And so finding the AHMA and getting that very nice handwritten note from the agent, who all they had to do was send back my SACE, but instead gave me a very thoughtful response, I did decide to return to medical school. So that's how so I went through medical school sort of closeted interest in integrative medicine. So that's how I got into.
So you mentioned that this group you found used to be called the AHMA. Has it changed names? Does it still exist?
It may still exist, but it's gone through some permutations. With integrative medicine being more mainstream now, they've begun to be not just an organization for physicians, but also an organization for the chiropractors and naturopaths and basically everyone that is interested in the integrative medicine movement, any providers. So it's not the organization it was when I was first looking at it. And it used to be the only source of looking for other integrative medicine providers, but there are a lot more other sources at this point that I'm happy to share with, at the end of this, I can, list the resources for that.
Okay. So what makes you so passionate about this? Your passion's obvious.
So a couple of things, and this is where I out myself a little. So, because, it's one thing to talk about science and the research you've done, and it's another thing to talk about personal experience and personal spiritual beliefs. I actually believe that I was reincarnated to do what I'm doing. I believe that that's my purpose on earth, is to, it almost makes me want to tear, that I'm here to spread the word on integrative medicine and psychiatry, to help other people that might have had their own traumas that are having a difficult time navigating it. So I do have myself a personal history of trauma, and no, I was not sexually abused, and no, I was not physically abused. In fact, I had very well-intentioned, very loving parents that to this day would literally give up their limb or life in a millisecond if they knew it would save the limb or life of their children. And despite their being well-intentioned and loving me that intensely, the fit between the way they were and my genetic temperament was not necessarily a good fit. I was a very deep child. I was very sensitive. At age 7, I was wondering, what are we on this planet for? What is the meaning of life? And my parents, who were more more occupied with day-to-day living, would look at me kind of confused, not sure how to answer that. And so I had my own challenges that I had to go through. And if I can help anyone go through less suffering than I had to go through, and find help in an easier way than I did, where I literally had to be in the field, knowing as much as I know to even figure out where to begin to get help, then I feel very happy about that.
It's fabulous. I mean, the idea that you can actually use your life experience as a guide and a motivator to help other people, even when those life experiences weren't so fabulous and exciting. Greg Moore's put together the idea of heart virtue, where he said you can figure out what your life purpose is by looking at the worst things that have happened to you in your life and find the one that when you think about it, it makes your blood boil, and then decide to commit a significant amount of your time, intelligence, money, and energy to make sure that very few people or a certain number of people have help recovering from that if it happens to them, or don't have to go through that. And you can turn your pain into your life's purpose.
Mm-hmm.
And
Love that.
And it sounds like a big part of what you've done here, which is benefiting you and everybody you come in contact with. So I think it's fabulous.
Thank you.
So how might somebody go about finding an integrative medicine psychiatrist?
So, searching the internet, but I would like to educate your listeners on terminology, because if you don't know the right terms to use, you're not going to be able to find what you want. And if there's a bunch of different terms thrown at you, it's going to get very confusing. So I want to talk a little bit about the terminology first. The first thing, integrative psychiatry versus integrated psychiatry. So the term is integrative medicine, and integrative medicine in psychiatry, as in the past few years, been shortened to just be called integrative psychiatry. Now, this is different than integrated psychiatry. That is a term coined by the American Psychiatric Association and has to do with psychiatric care being provided at the primary care physician's office, or the primary care physician and the mental health provider collaborating very closely. So that's a totally different thing. So don't get confused. Also, integrative medicine used to be called complementary and alternative medicine, or CAM. So if you see those terms, complementary medicine, alternative medicine, integrative, they all sort of mean the same thing. Other things I wanted to say, integrative medicine, in case you want to know, a lot of conventional medicine doctors may not know what that means. It is, however, a term defined in MEDLINE, again, the bibliographic database of peer-reviewed scientific journal articles maintained by the National Library of Medicine. This is the database that doctors and dentists and veterinarians use when they want to research something and see what studies were done or what case reports have been made. So they have, the MEDLINE has all these terms, like, definitions and terms that you can punch in. And integrative medicine is indeed a mesh subject heading, a medical subject heading within MEDLINE. Now, there are subcategories within integrative medicine that may not be categorized in MEDLINE and are used in the vernacular, or it's an idiom, but it may not have made its way to MEDLINE yet. So one of those terms is functional medicine. Functional medicine is a subset of integrative medicine. It is a subset. So it's not that all integrative medicine providers are functional medicine providers. I am not a functional medicine provider. A functional medicine provider is an integrative medicine provider that has been trained by the Institute of Functional Medicine. This is one of several professional organizations that train physicians to become integrative medicine providers. But you could do a Google search for functional medicine psychiatrist to see what comes up. That would be a way to find an integrative medicine psychiatrist. Other things, I already talked about that allopathic is a synonym for conventional medicine, and that allopathy was coined by the homeopaths. A homeopath, homeopathy, that's a kind of energy medicine. I wouldn't say that falls under integrative medicine, but homeopath, just being a homeopath, that doesn't mean you do everything else. Homeopathy is a kind of energy medicine where you believe like treats like. So you believe that the body's fever serves a purpose to fight off the illness. So you might give the patient a substance that actually induces a fever, but actually you don't give it at the dose that induces a fever. You give it at a really, 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 really diluted dose, to the point that conventional medicine would say there's nothing in there. So it's it's more energetic than it is an actual thinking in terms of a substance. So, you could do to answer your question about how to go about finding an integrative medicine psychiatrist, you can look up the word integrative, you can look up the word functional, you can look up the word complementary alternative medicine. So ways to find integrative psychiatrists, there is a directory that I used to maintain up until just recently, but I'm talking later on today to one of Journey's Dream founders, Mitzi. to talk to her about giving my list of 300 psychiatrists to your organization. So that will be one way, potentially. As far as finding functional medicine providers, there is the Institute of Functional Medicine, IFM, and on there you can look at their provider network directory. There is the organization I used to belong to, the American Holistic Medical Association, AHMA, that might have a provider directory. And the last one, and this is not as intuitive, it's called the American Academy of Anti-Aging Medicine, or A4M. That's another organization that is integrative, that if you look at their provider directory, you might be able to find an integrative psychiatrist. There are a few other ways, but those I'd say are the top ways that I'd recommend at this point.
Well, and two things I want to get to on your list
Sure.
of suggested questions. One of them is how people contact you.
Mm-hmm. So probably the easiest way is to go on my website, which is drlmassoumi.com. So that's doctor, just the abbreviations, DR, my first initial L, and my last name, Massoumi, Massoumi. However, if you can't remember that, if you do a Google search for Michigan Integrative Psychiatrist, as of February 2020, I'm one of the top results to come up. So you could just do that. And again, my reminder to your listeners is if you do contact my practice, there's a good chance you'll be seeing, most likely chance that you'll be seeing one of my physician assistants. And if you are not satisfied, which 99.9% of the time people are, but if you're not, you have always the option to be escalated to see me.
So what separates you from other integrative medicine psychiatrists?
So I don't know to what extent this separates me from other psychiatrists, but I will say I don't feel like I've met someone who's like me in the following ways or in all these ways combined. So sort of going through them, I mentioned earlier that I identify as having a personal history of childhood trauma. I also do have a history of being bullied for 2.5 years, and I'm still not completely over it, I'll be honest. Part of the reason I'm nervous doing this video is because I'm like, oh my God, how am I gonna look? How are my, 5th grade peers gonna perceive me? And so when I was in medical school, when I took my leave of absence, I suffered from depression, and I was misdiagnosed with a bunch of different things. I also have some traits of ADD. It was diagnosed as bipolar because I speak loudly, or at least at that time I did, and I spoke quickly, or at least that time I did. And so I was placed on a whole host of different medications. I will say the bulk of the medications that I prescribe, I have actually taken. Just about every family of meds that I prescribe, I have been on. So I know what the textbooks say about the medications, and I know what I experienced. I also did experience seeing providers that absolutely let me down. In fact, I don't think I ever found anyone that met my needs until I was well more advanced in my professional career. I have experienced being invalidated, taking my first dose of Zoloft, feeling better within 20 minutes, being told that was a placebo response, and my experience being invalidated, even though my mood was immediately better. I've since learned that people on the bipolar spectrum will notice a benefit immediately. People with traits of bulimia might notice a benefit immediately. And so I've definitely learned that when my patient says something, I listen to them and I believe their experience. And if I have 3 patients that all experience the same thing, I don't care if the studies or the textbook are saying that what my patients are saying is incorrect. It's got to be, to me, it's got to be true, or the universe wouldn't have brought it to me. So I have a personal history of having been a patient. I also identify as having some traits of Asperger's. So anything related to my field is absolutely fascinating to me. So psychiatry, psychology, animal behavior, sociology, anthropology, if it's related somehow to the mind and behavior and understanding people and the way societies are, I am fascinated. And if it is outside of that realm, I can't make myself pay attention to it. And I am oblivious, and I could look really uneducated if I have to talk about something other than my field. And along the lines of identifying with some traits of Asperger's, I literally identify with just about every diagnosis in the DSM. Like, I've never met a psychiatrist say, I think I have everything. But I really do believe that at one time in my life, I've gone through every diagnosis. And so because of that, the only two exceptions are schizophrenia. Yet on both sides of my family, there is heavy schizophrenia. I have a lot of experience firsthand interacting with schizophrenia. I used to chair the inpatient unit of a hospital, and there was a lot of schizophrenia on the unit. So even though I haven't experienced it myself, experienced it as a patient, I've experienced it very closely as a family member of. And then the other illness I can't identify with, thank you, universe, and please don't try to teach me any more lessons, is substance abuse addiction. So for that, I definitely refer out. But everything else, I understand what it feels like to have gone through it. So when I ask questions of my patients, I am not asking the questions according to the textbook and checking off boxes. Like, I literally know how it feels. And when you describe to me what you're going through, I'm just like, oh yeah, that's when I felt this way. That's what this is. And oh yeah, that's when I felt like this. That's that. So that makes me a little bit different. Another thing is, and this could be the Asperger's, this could be because Myers-Briggs, I'm an INFP or whatever the case, I tend to be very honest. So when I know what I'm talking about, I tell you. If I don't know about something, I tell you. If I'm unsure, I tell you. And I feel like that helps my patients know whether and to what extent to listen to what I'm saying. If you're asking me about using ketamine troches as a way to get off of your Lexapro, and I've used ketamine intranasally, but I haven't used it as a sublingual, then I'm going to tell you, and I'm happy to go on this journey with you, but I'm also happy to refer you to people that I know are using ketamine in this manner. Another thing, and this might be shared with a lot of my other integrative medicine peers, I am very spiritually minded, and I believe that everything I've gone through is for the purpose of helping my patients, whether it is a psychological problem or it is a medical problem. So recurrent sinusitis, allergies, irritable bowel syndrome, acne, recurrent yeast infections, whatever it is, if I've been through it and I found a natural way to overcome it through my own healer's journey, then I'm sharing that with my patients. And I feel very strongly that there's a reason I go through what I go through. Another thing, and again, this is where I become woo-woo, is I'm just being honest, I identify as being what's called claircognizant. And that means I'm intuitive in certain ways. And the way that I seem to be intuitive, my life experience is showing me, is for some reason, when I'm presented with a periodical of a bunch of different journal articles, study findings, for some reason, of the 50 that are listed there, 2 will jump off the page to me. And I find it really interesting and really pertinent, and it resonates with me as being true, and I implement it in my practice, and it turns out that it's true. And then years later, there's all these other studies coming out validating the initial studies that I already had a felt sense that were true. And I don't know how I do it, but it seems to be happening. And then the other thing is, when I go to a medical conference and I listen to a whole bunch of different speakers present their research findings. For some reason, I can just tell who's telling me the truth, who's like really smart and humble, and I can rely on what they're telling me, and who's maybe more narcissistically defended and is pumping up their results to look good or to not look stupid. And listening to the experts that I have considered, yes, I'm going to trust this expert, always seems to work out for me. So I think the claircognizance helps. And then the last thing is, I don't get reimbursed for the work that I do chairing the American Psychiatric Association group on integrative medicine. So I do a lot of work. There's no pay whatsoever, but there is a perk. And the perk is by bringing in the researchers of herbals to the APA to present their findings to conventional-minded psychiatrists. I get to know the researchers, and get to know the inside scoop of what the pros and the cons are of the various different herbal formulations and the different herbal brands. And so I have some inside knowledge that I think if I wasn't the chair, I wouldn't have. And so that's part of what patients are getting when they come to my practice, is they're getting some inside knowledge about, okay, for this particular herb, which is the patented form that you absolutely have to stick with.
Wow. Just wow. Just that. Just wow.
Okay.
Well, when you responded to my request for the interview and sent me a little information about yourself, I got excited about the possibility of sharing the knowledge of who you are and what you have to offer with this audience. And you've over-delivered. This was fabulous. Absolutely fabulous. I look forward to our continued connections. What I'll do is I'll send you a little bit about me, because you barely know anything about me. But is there anything that in this exhaustive list of things that we haven't mentioned that pops into your head that you want to say to our audience before we wrap this up today?
I would just hope that anyone, I'm going to start tearing again. I would just hope that anyone listening to this who's going through or has gone through anything, and or who feels ashamed or who feels like it's difficult to get help, I just want to give you hope that you can do this. You are amazing. Help is out there, and you are going to be a better person for what you've gone through.
Yeah, if I could find a way to improve on that, I would. You are a blessing. Thank you so much for being on this podcast. I look forward to doing a shorter version in the near future, doing a shorter one after that, so we can offer new things that you've learned and continued exposure to you, to our audience. Thank you so much.
Sure, my pleasure. Thank you.
Blessings.
Blessings to you as well.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.